You're watching Life Report, pro-life talk, real-world answers. Life Report trains people to more effectively defend their pro-life beliefs while honestly examining the strengths and weaknesses of both sides. We're the show other pro-lifers may have warned you about. This is Life Report.
Welcome to Life Report. I'm your host, Josh Brom. I'm joined by two special guests today. We have Lila Rose, the president of Live Action here, and David Schmidt, the media director with Live Action. Thanks for being with us tonight.
Our pleasure.
You have a new project that is all over the interweb. And so that's what we're going to chat about tonight. If you go to liveaction.org right now, you're going to see a big new project, I Stand With Indiana. What is going on in Indiana right now? Why is that where you guys decided to do your new project? Lila.
Well, what's happening in Indiana is it's become ground zero for the defunding of Planned Parenthood efforts in our country. So basically, we have the biggest abortion chain in our nation, getting over $300 million taxpayer dollars, and that's filtered down into all 50 states in different forms. And in Indiana is one of the first states to bravely stand up to the federal government and say, we don't want to fund the biggest abortion chain. We don't stand for that. We want this Medicaid money and this health money to go to other health providers that don't commit abortion, that don't kill unborn children. And what happened in Indiana just in the last few weeks is a judge made a ruling, an injunction on Indiana's stand to stop funding Planned Parenthood. And so Live Action, which has investigated in Indiana for the past 3 years, finding Planned Parenthood committing a whole line of abuses, covering up sexual abuse, giving misinformation to women, giving fraudulent information to women. And we are now launching a campaign to demonstrate that in Indiana, first of all, Planned Parenthood is not necessary for women's health. There are over 800 other health providers in the same counties that Planned Parenthood is operating that can provide for women. And then also demonstrating that Planned Parenthood, in their own words, say that they're not necessary for women's health, so they should definitely remain defunded in the state of Indiana.
Take a step back for us. For the people who have not done as much research as you guys, help us understand the relationship between abortion and Medicaid.
Sure. Well, the federal government, and David, just jump in and interrupt me any minute.
I will.
In Medicaid money is being used as a front for Planned Parenthood because they have set up this whole system that ultimately centers around abortion, and they have these other supposed services, and they try to suck in government money for those other services, saying, oh, we're not really spending it on abortion, but building a whole name brand, marketing program, trusting relationships with women to ultimately build their abortion business. It's not very well publicized, but the reality is they've been upping their abortion numbers over the past 10 years at Planned Parenthood. They do more and more abortions every year. Well, the national rate is static or even drops. So it's clear what their agenda is, and they're using Medicaid patients and the poor as a front for their abortion business.
Now, and then recently, if I understand it right, President Obama came out and said because Indiana, there was a bill and they defunded Planned Parenthood. They're one of the few states, a few states now that has. And from what I understand, President Obama came out and said that he would do what?
Well, he would cut off the federal contribution of Medicaid funds to Indiana.
All Medicaid funds?
There's discretion there in terms of whether it would be partial or full, but there would be some sort of a punishment there, and it could be in excess of $4 billion.
Has that threat happened to any of the other states? Because there's like 3 or 4 other states that have defunded Planned Parenthood. Has he pointed out Indiana?
The states have defunded Planned Parenthood in different ways. In some states, they've removed them from getting state grants. They've removed them from various other programs. Indiana was one of the first states to make their defunding through the Medicaid program. And saying that Medicaid funds are going to be directed to other providers.
This is why Indiana is ground zero, because if the Obama administration gets away with forcing the state of Indiana, with Hoosiers in the state, to fund abortion provider Planned Parenthood, then they're going to step in and do major government intervention in other states, violating states' rights and ultimately forcing the hand of American people to fund an abortion provider, an abortion chain. So that's why we're doing the IStandWithIndiana.com petition to say this is ground zero. If the Obama administration administration gets away with it in Indiana, they could get away with it in other states. We have to stand up with Indiana right now.
So that explains why you guys chose Indiana. So what did you do in Indiana?
Well, we've been investigating there for 3 years, as I said earlier, and we've documented sexual abuse cover-up of girls as young as 13. I've posed as a sex abuse victim. We've documented medical misinformation and their clinics in Indiana. But most recently, we released an undercover video just last week where we had an actor call up over half of Planned Parenthood's clinics, saying that they were a Medicaid patient, asking for help, asking for services. And this was during the time before the federal judge intervened and when they no longer received, Planned Parenthood no longer received Medicaid money. I mean, the state of Indiana had voted not to give them that money. And so our actors asked Planned Parenthood workers on the phone, and these are the lower level workers. They're not the national PR department who's doing this fear campaign and saying that women won't have health care in Indiana, but they're just normal everyday workers, and they tell our actors in all of the phone calls that it's not a problem, that there's a primary care physician that they can go see. They refer them to other local clinics. They tell them that the other clinics have the same services that Planned Parenthood has, ultimately telling our actors that they are not essential for their Medicaid health care and that they can go elsewhere, demonstrating that this is a big fear campaign where the Obama administration and Planned Parenthood leadership is bullying the state of Indiana to force them to fund an abortion provider.
We have some of the audio from that video. It's about 30 seconds from the phone calls that Live Action made to Indianapolis and Michigan City Planned Parenthood facilities.
Is there another clinic that we should try or something else that we should?
You need to probably go to your primary doctor.
Okay. And they would be able to provide the same services. There wouldn't be.
Yeah.
Okay. So well woman exams and STD tests and things like that.
Yes.
Okay, but I can get a well woman at my primary care.
Your primary doctor should be able to do that. That's what they're there for.
So what's been the response? Like, it seems like the video shows exactly what you're saying, that there are other places that women can get this kind of care. What has been the response?
Their response, which is very typical for Planned Parenthood, was, well, we have good office hours. I mean, totally not even responding to Live Action's investigation, not even addressing the reality that there are 800 other health providers, Medicaid providers in the same county as Planned Parenthood clinics, but coming up with a very lame, almost laughable excuse that they have better hours. And it's completely undocumented, first of all, and it doesn't even, they have no indication that the other health providers have less, poor office hours. But beyond that point, I mean, we're voicing the opinions and we're passing on the statements of people like Dr. Geoff Cly, who's a physician, an OBGYN who accepts Medicaid patients with a whole organization of other doctors in Fort Wayne, Indiana, for example, saying that any minute they're willing and ready to assist with Medicaid patients. And the bottom line here, and what I think, coming back and looking down at Indiana in context of the rest of the defunding efforts, is that Planned Parenthood's #1 excuse to receive taxpayer dollars, even as they're the biggest abortion chain, is that they're somehow essential for women's health care. But there are two realities that completely contradict that claim. First of all, they are dangerous for women. They cover up sexual abuse. They aid and abet the trafficking of sex abuse victims. They give medical misinformation to women. They provide these dangerous abortion procedures, which are physically and emotionally dangerous for women. And second of all, there are over 7,000, almost 7,000 federally qualified health centers that actually do real health care, preventative and comprehensive health care for men, women, and children in our country.
Right.
And they don't have a powerful lobbying presence in D.C. They don't have this beautiful, fancy brand name that Planned Parenthood has worked so hard to develop. They're these places that are concerned with actually doing healthcare instead of waging these ideological campaigns. And that's the reality of healthcare in America, which is the big point that we hope that this Indiana situation helps people to realize.
So it seems like the most common response I'm hearing from pro-choice people about the video is that it seems like, okay, even if you don't like Planned Parenthood, they'll say, I understand you're against abortion, you don't like Planned Parenthood, but it seems like when you're just talking about well woman care it seems obvious that the more centers doing it, the better. And in fact, I'll just give you one question from Mickey in India, who's pro-choice. He said, if I were a woman in that state and found out that I had cervical cancer too late because I couldn't go to Planned Parenthood, I would sue the crap out of the government, Live Action, and every other lobby organization. Respond to those concerns.
Well, the question is whether women have access to the important health care that they need.
Right.
And in Indiana, they do. It's not that Planned Parenthood is their only option. There's just in the counties that Planned Parenthood is, there's 800 other providers, and Planned Parenthood only serves about 0.8% of the Medicaid patients in Indiana. I mean, that's less than 1%. So if all the Planned Parenthood Medicaid patients went to other providers, it would be something the system could easily absorb because it's less than 1% of the patients already. It's not like they are, serving half the market and it's going to cause a huge disruption. Where they are serving over half the market is abortions. They provide 52% of all abortions in Indiana. So that's where they have a kind of almost like a monopoly position.
Right. Anything to add to that, Lila?
Totally. And Mickey, I appreciate your concern for women as a woman and for screening for cancers that are very dangerous and we want to protect women from. But the way to protect women is not to pour money into an abortion chain, which has a radical ideology that is so pro-abortion that they're willing to endanger sexual abuse victims and even trafficking victims and give misinformation to women. The solution, if you want to go through the government, is to give that money to actual health providers who do real comprehensive and preventative care, like these federally qualified health centers across our nation, not an organization that's number one priority is abortion, and that's demonstrated by the fact in Indiana that they do over half the abortions, but they're serving less than 1% of Medicaid patients. I think that would be my answer to you. And please go and promote those other federally qualified health centers, not a radical ideologically driven abortion chain.
I'm going to move us on to another topic in a second, but before I do, what is it that you're wanting people to do? You can go to istandwithindiana.org.com?
.com or .org. But, yeah.
Okay, you got them both. You're asking people to sign a petition. What is it you're wanting pro-life people that are hearing this to do?
Well, sign the petition. That letter, you can click all the boxes. It will go to President Obama. It will go to your representatives. It will go to the Senate leadership. It'll go to the House leadership. It'll go as an encouragement letter to the leadership, the political leadership in the state of Indiana. And that letter will also be in solidarity with pro-lifers across the country who are standing up and saying enough is enough. It's time to defund Planned Parenthood. So that's action item number 1. Number 2, pass on the video. Educate your friends, educate your social media networks, educate your Facebook friends, educate your family, educate coworkers. Make sure that everyone realizes the truth about this organization and about the fact that there are better healthcare options for women out there, and those are the options that should get our attention and our support.
Anything to add?
Indiana has a right to decide where their healthcare dollars go. They know how best to serve their state, and it's really important that we stand up to this bullying, because if they can force this agenda upon Indiana, they can force it on every other state, and they have forced it on every other state. And that's why it's important not just people in Indiana stand up, but really the whole country stand up and say, my state is going to take responsibility for where money goes in my state, and we're going to make sure it goes to the best places, not ideological providers that have huge lobbying campaigns and seem more engaged in the political process than they do in making sure that people get the best care possible.
It sounds like what I'm hearing from you is that this is a landmark case, and this is where what happens here it could have a huge effect on other states.
If this succeeds, what has happened in Indiana will probably, in short order, happen in states all across the country that have pro-life legislatures and pro-life governors. So really, this is the main bellwether test of whether states are going to be able to have that freedom, and whether federal judges, not state judges, are going to come and dictate to that state. And we may even see this case go all the way to the Supreme Court.
I think that's awesome. I think people should go to the website. I've signed the petition myself. I'm in complete agreement.